Welcome to Vet Fraternity. In this video, we are going to talk about Collie Eye Anomaly. Well, Collie Eye Anomaly is a congenital recessively inherited ocular defect in rough and smooth coated collies. So basically, first thing is that it is congenital. It runs in this breed that is called as collies. The main abnormality is an area of choroidal or retina and choroid that fails to develop fully. So either it is going to affect just the choroid or it is going to affect retina or choroid both. And because of that, they fail to develop fully. So it can be choroidal or it can be chorioretinal hypoplasia because there is failure to development. So it's hypoplasia. Some dogs are 100% blind while others are normal. Most severely affected dogs may have additional issues like colobomatous lesions, occasional retinal detachments, and retinal hemorrhages. A genetic test is available to identify the carrier dog. So, how many points we have discussed so far? First thing is it's a congenital. It runs in collies. It can affect either just the choroid or retina and choroid both, and they fail to develop fully, so it's a hypoplasia. Dogs can be blind 100% or they can be normal. And in severe cases, additional issues like colobomatous lesions, we have discussed already what coloboma is. The other thing is retinal detachment or retinal hemorrhages. And a genetic test is available to detect the carrier. We can see the images. You can see in the first image, this is a normal eye. But in the second image, what we are seeing is a coloboma that is a pit in the optic nerve. Basically, here you can see how optic nerve appears depressed compared to this normal one. This can lead to visual impairment or may remain incidental because we have talked about the dogs can be completely blind or they can be normal. Uh, and in this image, this is choroidal hypoplasia. In this image, what you can see is that this region has reduced opacity or reduced pigmentation, not opacity. This region has reduced pigmentation and abnormal vessel visibility due to poor choroidal development. So these are the images like how Collie eye anomaly looks like. That was all about it. I hope you enjoyed the lecture. Thank you.